Hello, good afternoon. My name is Soto, and I am doing the video for the dressing application. My patient today, I picked to do the neck spanum removal. This is a procedure that we often do in the clinic where I work, and I thought it would be one of the easy ones to do. It uses a few dressing, and so I will demonstrate the proper way that we dress the patient after they have the neck spanum removal. Of course, we always use our gloves. We always have our mask on, and we have the sterile fill next to us. And of course, I have my patient here. So I am just gonna pretend right now that she's done. The provider, the physician left already, and now it's just my part that I'm gonna put in the dressing. This is where the neck spanum was removed, and I'm just cleaning her off with this is a Dermaseat 4x4. We'll use this to clean her incision area a little bit. Okay. There's two plies here, so I'll just use one just to kind of go around. And then you can still see some stain after that. We always use a little bit of alcohol prep just to clean around the area. Okay. We don't want this to stain the clothes, so we clean this out like that. Okay, after that we have the sterile tip. We have the sterile strips for suture. And so we cut it out a little bit and we go across on the incision where we remove the neck spanum. You can get it. There we go. So we'll just grab one little patch like this. They're easy to peel. And then I'm just gonna cut it in half if I can. It's hard when you have your gloves on. So we'll put one piece just around there to cover the little incision, if you can see it. And then a second piece that's gonna go across where the incision is. Right in there. After we do that, we go in and put a second. The Dermaseat is a 2x2. We just put a little ply on it. Okay. So with this, we'll cover the incision out. The sutures, the strips will not come out until 48 hours, so the patient can shower with it, and then in 48 hours they can come off. We'll put in the little 2x2s in here, and then I also have a band-aid that we can put over the 2x2. Okay, here's my 2x2 here. So we put this over. Okay, and this, she can remove this anytime, but we want to keep the sterile tips out for 48 hours. After this, after we place a 2x2, then we cover her up with a 3x12 stretchy band-aid roll. Okay, this is the last step that we do when we do the neck spanum. So we just go around the patient's arm and around until we finish covering the patient's incision. And then she can remove this in one day or today if it's too tight for the patient here, and this will help keep the incision and any bleeding coming out. The patient is also instructed to see any bruising, any bleeding, and if she has any of those complications, she should give us a call. But right in here is the band-aid and the 2x2 right in there, so she should be fine. If this is too tight, patient can always remove it and then apply it to her arm again.